Good morning, welcome. Can you hear me at the back? Yes. I'm impressed that so many people came in this rainy weather, I must say. So my name's Jacqui. As Joe said, I'm the National Chair of the Hearing Voices Network in England. I'm Honorary Research Fellow at Durham University, at Birmingham City University. I'm Honorary Lecturer in Clinical Psychology at the University of East London. And I have 3 O-levels and a CSE Grade 2 in maths. So I'm very clever. This morning I'd like to talk for the next hour a bit about my own experiences of using mental health services and really how that led me into the work that I'm doing. What I'm going to say may be challenging for some of you. That's my intention, really. I think if I'm going to come all the way from London, then it's good to be a little bit provocative. But hopefully we can have a chat after my talk about some of the things that I raise, and I'll also be running a workshop this afternoon to explore some of these things in more detail. So the personal is political. This notion really came out of the women's liberation movement in the 1960s and 70s. So the experiences, feelings and possibilities of our personal lives are not just a matter of personal preferences and choices, but are limited, moulded and defined by the broader political and social setting. They feel personal and their details are personal, but their broad texture and character, and especially the limits within which these evolve, are largely systemic. A bit of a grand start. I have been accused of grandiosity. As I said, this idea came out of the women's liberation movement in the 1960s and 70s, and really it was an attempt to acknowledge that women's experiences of oppression, of discrimination, of lack of equal opportunity wasn't just a personal issue. It wasn't a personal failing, that it was something that was happening within a much wider social and political context. And when I came across this concept again recently, I thought actually this is very relevant for mental health too. That when you go mad, as I like to call it, when you lose the plot, when you have a breakdown, when you become very distressed, it's not just a personal catastrophe, although of course it is. It's devastating. One of the things that has been crucial to my own healing and recovery has been the recognition, really, that these experiences are happening within a much wider social and political context. So that's really the frame for my talk this morning, this idea of the personal and the political. But I'd like to start with the personal, just to give you a sense of where I've come from and what brings me here. So this is a picture of me, aged 5, on the street in East London, where I grew up. By the time this picture was already taken, I already had begun hearing voices, and in fact many children begin hearing voices at a very young age. And the reason that I believe that I began hearing voices and having these very frightening experiences is because many frightening things had already happened to me by the time this picture was taken. My mother, my father, and other members of my immediate family were involved with a group of organised paedophiles who abused me and many other children in my local area. To be betrayed and exploited by the very people that are meant to protect you is absolutely devastating and leaves you with a profound sense of aloneness, shame and horror. I'm not going to talk a lot about the things that happened to me. We read our newspapers, and fortunately these things are becoming better known and widely accepted. What I'd like to talk about really is both the impact on me and how I survived those experiences. So, as I said, I was born into this family that perpetrated abuse, and there was a lot of abuse happening in my local area. And one of the things that was most devastating about that, as I just said, really, is that the abuse was perpetrated by the people that were meant to be protecting me. As well as this horrendous abuse that I experienced, I also experienced lots of ordinary, everyday neglect. I have lots of memories of being left at home as a very small child on my own, and just this terrible this loneliness that I felt that went on and on and on. Of course, children don't really have a sense of time, so being left alone for long periods just seemed to go on forever. One of the things that was really crazy making for me, and I think this is true in lots of abusive families, is the denial. So behind closed doors, this organised abuse was happening. But then when I went to school, it looked as if everything was fine. And my mum would take me to school and she would look like a lovely, ordinary person, which was quite crazy making for me. So one of the things that I grew up with was this sense of there being a dual reality, a reality where all of these awful things happened behind closed doors, and then this other world where everything was fine and we all pretended everything was happy. Of course, the people that were abusing me were very sophisticated, and they had a lot of mechanisms that they used to silence me. And there's quite a lot written about this, that the tactics that paedophiles use to control and silence children. One of the methods they used was to blame me. The abuse was my fault, I asked for it, I deserved it. And as a small child, it's actually very difficult to defend yourself against those kinds of messages from very powerful, terrifying adults. The other thing really that I like to think of as the cherry on the cake is that I was threatened. I was told that if I ever spoke about what happened, I would be killed, that the person that I told would be killed. And I believed these people because they seemed to be able to act without any consequence. So their threats I took very, very seriously. And I never spoke about what happened to me for many, many years. So how did I survive? Well, I'm not sure sometimes, I must say. But I think there's a number of ways that I survived. And I think the first is that I began hearing voices. And I'm going to talk quite a bit about this morning, but typically hearing voices is seen as a symptom of a serious mental illness. But in fact, for me, hearing voices was a life-saving strategy. It enabled me to survive these devastating experiences. One of the first voices that I began to hear was this voice of what I call the Great Mother. She was this very powerful maternal figure that would come to me. I would see her and I would hear her. And she was very powerful, she was very beautiful, and she would say really loving and soothing things to me, like, you're a lovely girl and I love you and I'll be here for you. And she, I think, enabled me to survive with some sense of my humanity intact, and has also enabled me to become a loving mother to my own children. So I later, of course, began hearing lots of other voices, and I'll talk about that in more detail shortly, but I'm very, very clear that my voices, even though at times they've been very frightening and disturbing, that they have enabled me to survive, and I'm very grateful to them. I think one of the other ways that I survived is that I began to cut myself. I remember being about 7 or 8 years old in my bedroom at home and feeling terrible about the things that were happening to me. I felt horrified and disgusting and ashamed and very, very angry. And of course, I had no one to talk to about any of those things. And I remember one of my voices saying, "Why don't you pick up that piece of glass and cut yourself?" And I did, and I felt this enormous sense of relief. So I discovered this way of safely releasing all of this anguish without hurting anyone else, and it seemed like a really nifty way to survive. One of the other ways that I survived is that I developed what some people would call an eating disorder. I like to think that I had a very complicated and sophisticated relationship with food. Food became this magical mystery tour where I discovered that there were very many ways that I could control what I eat and starve myself, overeat, a number of things that I could do that would make me feel more in control. And actually, I think a lot of eating distress is actually about trying to exert some control in situations when people feel very, very out of control. I was also very creative. You know, at home I was told that I was stupid and people didn't really take me very seriously as a person. But I was very fortunate in primary school in particular that my teachers really valued me. I was considered a bright and gifted child, and I really thrived in that kind of environment. And I think, again, that was one of the ways that I survived, finding good people in my life that were able to see my strengths. That's been really, really crucial to my survival. So I've always been very resourceful, and I would say that all of my coping strategies, including the cutting and the voice hearing and all of those things, were incredibly resourceful ways to survive. I think the other thing, people say to me, how have you survived such devastating experiences? And I think one of the ways is this sense of utter outrage that I have, which actually I think is quite useful to feel outraged. So I always had this burning sense of justice. So even though the people that hurt me told me that these things were happening to me because I deserved them, and a large part of me believed that, there was this burning part of me that knew that what they was doing was terribly, terribly wrong. And I used to have a fantasy that one day I will be safe, I will be free, and I will be loved. And really that idea kept me going for a very, very long time. The abuse ended when I was a teenager. We moved to another area, and I'm summarising what is, of course, a much more ugly and complicated story. I left home and I managed to get myself a job. And again, this sense for me of this dual world persisted, where I would go to the external world and kind of function, but in my sort of private world, I felt tormented. I still hadn't talked to anyone about what had happened to me because the voices of my abusers lived on and on and on, threatening me that if I ever spoke about what happened, that they would kill me. The thing that really liberated me to start speaking about what had happened to me was the birth of my first child. And like many people, men and women who are survivors of abuse, becoming a parent is often a huge turning point, very painful and life-changing and amazing experience all bound up in one. My daughter was very much planned and wanted, and the day of her birth was one of the happiest days of my life. It was the first time that I ever felt really proud of myself. And I was overwhelmed with joy at the arrival of this beautiful, perfect little being. Unfortunately, very quickly, this idyllic scene was invaded by demons from my past. And I remember when she was very, very small, I began having these very terrifying experiences where I would be changing her, and then suddenly I would look at her and she would be covered in blood. And then I would blink and it would disappear. And so I began having these awful visions. My voices multiplied and became much more terrorising, saying that people were going to hurt us and take us somewhere. The voices began telling me to cut myself, and that if I did, that would protect me. And I began starving myself, really, in an attempt to sort of gain some control over these overwhelming feelings. And it was a really, really difficult time. And I think one of the things that made it so difficult is that I wasn't able to talk to anyone because I felt so utterly ashamed. And I managed to keep myself going for a while, and then I became so despairing that I seriously considered taking my own life because I felt that there was really no escape from these terrible experiences. To cut another long, ugly story short, I ended up in psychiatric services. And really, for me, ending up in services felt like I felt like a huge failure. And there I was in this acute psychiatric ward in inner city London, and it really was like hell on earth. They were mixed wards at that time. It was a bit like a Carry-On film, you know, you had a little curtain around your bed. And as a young woman who was very terrorised, I was on this ward and surrounded by many other people who were very distressed. Many of the patients had been in hospital for many years. And I sat on that ward for about 5 days, and no one spoke to me apart from other patients asking me if I had a spare fag. After about 5 days, a member of staff came to me and said, "Are you Jacqui?" "Yes, I am. I'd like to speak to you." And I was taken to a small room, and I discovered that I was going to be assessed by a psychiatrist. The psychiatrist began asking me lots and lots of questions about my family history of mental illness, about my so-called symptoms, etc., etc. And bear in mind that I've never talked to around anyone about what's happened to me. So we're in this small room, me, the psychiatrist, there's a desk and a small filing cabinet. I think it had formerly been a broom cupboard, you know, one of those that they turn into an office. And anyway, he began asking questions, more questions, more questions. All the while, I'm becoming more agitated. And then eventually, he said, I said to him, "Please, can I say something?" "Certainly." And I said to him, "I've never told anyone this, but when I was a little girl, my family were involved with these people." And I began to tell him some of the things that had happened to me as a child. And he said to me, "Jacqui, can I stop you there?" "Sure." We've had lots of other people in here reporting those kinds of experiences, but when we get their family in and we all sit and talk about it together, they realise that this is just a part of their illness. And these things haven't actually happened to you. You are psychotically ill. You have psychosis. And you're seriously ill and you're in the right place. And this icy shiver ran down my spine. And then one of my voices began shouting, "Pick up the filing cabinet and drop it on his head." Fortunately, I didn't do that because I'd probably still be in a secure unit somewhere now, wouldn't I? But fortunately, another voice intervened and said, "Get out of the room now. Just get out of the room now." So I said to him, "I'm not feeling very well. Can we please finish this consultation now?" "Certainly." And I left his room, I walked down the corridor, I went into the ladies' bathrooms, I went into a cubicle, and I smashed my head against the wall. Because I knew then that the place that was meant to provide me with sanctuary and safety was actually the place that was going to send me over the edge once and for all. So I just would like to summarise my experiences of the mental health system. This isn't an indictment on mental health services or other people's experiences, this is my experience. Everything I said and did was pathologised, so when I became very distressed, I began sobbing and sobbing and sobbing at the fact that my very real experiences of horrendous abuse were being denied. I was told, "Well, that's a symptom of your illness." And then when I became angry about my treatment, I was told, "That's another symptom of your illness." So in fact, everything was seen as a consequence of this supposed illness that I had. Of course, I encountered all of this denial. I was told repeatedly those things didn't happen. It didn't happen. It never happened. You're ill. These are delusions. But I did encounter one psychiatrist in that lovely experience of a ward round where you get, 15 mental health professionals who don't really know you speaking about you with real authority. You know that one? And there they all were speaking about me, and this consultant psychiatrist said, "Well, it's quite possible these things have happened to her. We do hear these stories, but she'll never recover. They never do recover." So I was sort of sitting there hearing them speaking about me in this way. The thing to bear in mind, of course, is that this hospital was the local hospital to where I'd grown up. So when they were talking about people who'd been there reporting these kinds of experiences, part of me wondered if these were the people that had been involved in the same paedophile group that I'd been abused in, of course. And there was a part of me that wondered, is this a conspiracy? You wonder why people become very paranoid, really, don't you? So of course, because I was deemed to be seriously ill, I needed medication. And I was actually very scared of taking medication for a number of reasons. But for me to take medication would have meant being believed. and trusting the person and working together in a kind of collaborative way. But at that point, taking medication felt like I was going to just lose myself. So I was very scared of taking medication. So the whole thing was about really becoming dependent and compliant. You must accept the diagnosis and medication, and then we'll give you benefits and a bus pass. Just what you've always wanted, really. So for me, it was an incredibly disempowering experience to be told that I would never recover. Bear in mind that I'd actually managed to get away from my very abusive family and managed to get myself a job and somewhere to live and a loving partner and had a family. So I had a lot really going for me. All of that was forgotten now because I was having these very extreme experiences. So I was told I'd never be able to work again, that I would always have this mental illness, that I would have to lower my expectations. And then there was talk about whether I would actually be able to look after my daughter or not. And that's when I knew for sure I've got to get out of this place. So I was really expected to be passive. I was expected to be a passive recipient of so-called care. I'll say it loud and I'll say it clear. As far as I'm concerned, there's nothing wrong with me. What I've had is a perfectly natural human reaction to devastating experiences. It's not because I was born with a genetic predisposition that I've handled things in this way. It's not that I have some inherent vulnerability that I've handled things in this way. As I've said to a lot of mental health professionals, believe me, if you'd had the kind of devastating experiences that I'd had, you may well have coped with them in very similar ways. And actually, would you have coped with them as well? Who knows? But at this time, I was in quite a tricky situation because I was in a psychiatric hospital. So how did I get out? How do people get out of hospital? Well, sometimes we lie. A few laughs of recognition. And so I started doing that thing where I started saying, oh, feeling much better now. Oh, I've had a nice rest. Thanks ever so much, everyone. I want to go home now. Don't know why I said all that stuff. And because I was a good actress, I've spent my life pretending things were okay when they weren't. And because I was articulate and because I was smart, they let me go. And I think because they were so overworked, if somebody's saying I'm all right, they're like, okay, off you go. So I went home. And my partner said to me, so what's going to happen? Are they going to follow you up? And I said, hopefully not. And actually, they never did. And years later, when I went back and saw my GP and asked to see my psychiatric records, they no longer existed. So whether that was due to the chaos in the system, whether there was something more sinister going on, who knows? But there is no record that I ever used psychiatric services, but this isn't a delusion, I really did. So I'd like to talk very briefly about what did help, because then I'd like to talk a little bit more about my work. I could talk about myself all morning. I know I'm endlessly fascinating, but I will move on. I think two good things for me came out of those really horrible experiences in services. One was that I moved from a feeling like there was no hope, that sort of utter despair that I felt. I actually felt outraged. I felt outraged at the way I'd been treated. And I think that sense of outrage was quite helpful, because anger gives you some energy and it motivates you to do things. So again, I think anger's often pathologized, but for me, my anger was really, really helpful. So I think that was one good outcome of going into hospital. I'm always trying to see the good in the bad, believe me. And the other was that I was able to start telling people in my life about what had happened to me. The first person I told was the father of my kids. I've had another child since. And when I told him about what happened to me as a little girl, he just broke down and cried. And I said to him, do you believe me? And he said, of course I believe you. I always thought your mother was weird. And we told our closest friends, and some of them couldn't handle it. I lost quite a lot of my friends, which was really heartbreaking, actually. But you certainly learn who your friends are in those sorts of situations. And I found a therapist to work with. And really that was life-changing, having somebody who was willing to listen to me and hear me and honour the experiences that I had had. I had to find a new way of thinking about my experiences. You know, this sort of biomedical model which sees people's experiences as symptoms of an illness, and that the sort of main way of dealing with those experiences is to medicate them away, just didn't really make much sense to me. So I began trying to find other ways of understanding my experiences, and I came across the work of Judith Herman, who in fact is a psychiatrist, and that book changed my life. And if anything I say today sort of resonates with you or makes any sense, and you'd like to read more about where I'm coming from, if you haven't read Judith Herman, Trauma and Recovery, check it out. But Judith Herman's work was really, really a huge turning point for me. That enabled me to start understanding more about dissociation, this sort of phenomena where people zone out, where things feel like they're happening to someone else. It's a really quite a complex phenomena, but it was a piece of the jigsaw about how had I managed to survive these terrible experiences. I read a lot of attachment theory. The work of people like John Bowlby and Winnicott was really important to me. And I guess what I'm trying to say really is that finding your own ways of making sense of what's going on for you is crucial. When I work with people now, I say to them, what do you think's going on? What sort of things are you interested in? You know, because of course that old adage, knowledge is power. So trying to inform yourself and find your own ways of making sense of what's going on for you, I think is crucial. And all of this reading, as I said, you know, I've got 3 O-levels, but I've got thousands of books in my house. You know, I'm self-taught, and really, you know, I talk about I've been to the School of Hard Knocks and the University of Life, but really, for me, just reading and trying to better inform myself and make sense of things myself. And really what became very clear to me is that I wasn't the only person in their living room feeling demented and lost and broken, really trying to put themselves back together again after devastating experiences. I knew there were thousands of people all over this country, all over the world, really attempting to do the same thing. And I used to go to my therapist one day, you know, I'm going to go out there and I want to speak at conferences and I want to tell people all about it. And he used to say to me, yeah, I'm sure that's possible, Jacqui, but you do need to watch that grandiosity of yours. And I joke to him about that now. You know, my grandiosities served me quite well, actually. So Judith Herman talks about this need for people to find safety, you know, a safe place, to really begin exploring what's most painful and what's most frightening for them. And then once safety is established, people can begin remembering and mourning the things that really have broken their hearts and that have shattered them. And then people can finally begin to reconnect with other people, with life beyond trauma. So for me, safety was about feeling safe and protected, to be able to talk about what had happened to me, to crucially find an empathic witness, you know, somebody who was willing to witness my experiences. For me, that was profoundly healing, because it meant that I mattered. The terrible things that had happened to me mattered. I began to feel maybe I'm not alone in the way that I always felt that I had been. Maybe I'm not crazy. Because I began speaking to my empathic witness, and I'd sort of say all this stuff that felt very garbled and distressed to me, and I'd say, do you understand? He'd say, yeah, that makes complete sense to me. And there was this huge relief. I make sense. So I began to feel that my responses actually are normal in these, you know, awful circumstances that I found myself in. I began to believe that recovery was possible, because if others can do it, maybe I can do it too. And by recovery, I don't mean accepting that I'm ill, taking my medication and being a good patient. What I mean is defining who I want to be and becoming the best that I can be of myself, really. And for me, it meant being able to accept support as an act of courage, to not see it as a sign of weakness, but be able to reach out and say, I'm really struggling actually, was a huge step for me, and was a real sort of commitment to my healing and my future. That really enabled me to start remembering and mourning for the terrible things that happened to me. I've spent years healing, and I still feel heartbroken really about the things that happened to me. And I think I'll spend the rest of my life really come to terms with the things that happened to me. Because essentially I had my childhood stolen. But what I've learned is that each time that I let some of that sadness and that pain out, there's more space inside of me for more joy and more peace. And my daughters know that when they've had a bad day at school, they come home and I go, what's the matter? No, I don't feel very good. You look like you need a big cry. And they have a big cry, and what they discover is they feel a bit better. So for me, the restorative power of truth-telling, creating space for people to start telling their own truths. And there's something enormously powerful in that when we start speaking our own truths, we begin to have a restored sense of who we are. For me, it was about reconstructing the story of what had happened to me in the presence of an empathic witness, and beginning to truly mourn for what had happened. And really that allowed me to integrate my experiences. I'm really whizzing through this. I'd like to take longer and talk more about this journey, but as I said, I want to talk a bit more about my work. But what I learned is that my voices weren't just these awful symptoms that I needed to get rid of. Actually, my voices were aspects of me that had been devastated by what had happened to me, and that each of them had become kind of internalized representations of my external world. So there were children and teenagers, the voices of children and teenagers, which really held the memories of the abuse from the perspective of victims. I heard the voices of my abusers, the voices of deniers and blamers, the comforters and the protectors. So, as I said, this lovely, great mother that used to come to me, and other protective voices. The intellectual guides, so the voices that would say, just get out of that room. No, do not hit him. That's not a good idea. Just get out of the room now. Those kinds of things. What I would call my spiritual connection, my connection to a sense of a higher power, or a sense of my own innocence. I don't really have a belief system as such, but what I do believe in is love. It sounds a bit naff, I know, but I do really believe in the kind of redemptive power of being loved and loving people, and really that for me is what kind of drives me. So what I learned is that it wasn't about banishing my voices, it wasn't about getting rid of them, it was about understanding them in the context from which they'd emerged, and to greet them with compassion and understanding, because actually they had helped me to survive. And that's why I say I feel actually enormously grateful to them. So the work was really about trying to work towards supporting and understanding each other, and really from somebody who felt broken, that I was in 1,000 pieces, and that I wasn't really a real person. There's this growing sense of connectedness and wholeness, and really life becomes a shared mutual collaboration. And occasionally when there's an internal disagreement, and I'll hear my voices disagreeing about a certain course of action, you'll hear one of them say, look, come on, let's sort this out for Jacqui. She's had a bit of a crap life. Let's sort it out for her. So thanks for that, guys. Really very good of you. So I still hear voices, and I will always hear voices, and that's cool with me. It's an important aspect of my experience. So the final bit of the sort of healing journey within the sort of framework that Judith Herman proposes is this reconnection. So really for me that was about reconnecting with my sense of ordinariness and my sense of being like other people. I felt like this freak for such a long time, and to actually encounter other people who'd had similar kinds of experiences, but also just to find that there's life beyond trauma. There's just ordinary things, going for a walk in nature, you know, just going out dancing with my mates, you know, those kinds of things where you just discover that there's just ordinary life. And, you know, I spent many years unable to leave my house. I would literally get a taxi to therapy and then come home again because I was too terrified to go out. And then slowly I joined a local user project for other survivors of sexual abuse. And then I began doing some voluntary work there. And then I began working for Childline. And so I began doing more and more voluntary work, which really increased my confidence and my connection to other people. And I began to feel as if I was doing something really important with these devastating experiences, you know, like alchemy, that you turn shit into gold, really. But there was one problem for me, this sense of outrage. What do you do when really people have done terrible things to you and essentially just got away with it? And one of the things that Judith Herman talks about is the need to find a survivor mission. She doesn't pathologise survivors' outrage. She doesn't say, oh, you know, that's borderline personality disorder, oh no, medication, oh no. What she says is that feeling outraged is utterly appropriate. But the problem for survivors is if they cannot find a constructive vehicle for that outrage. So for me, the work that I do is my survivor mission. So I'd like to talk a bit about my survivor mission now. I first became involved with the Hearing Voices Network about 12 years ago now. And the network is a network of people who hear voices like me, their friends and relatives, carers, support workers, a whole load of professionals who work together to gain a better understanding of voices, visions, tactile sensations, and other sensory experiences. And we work to reduce ignorance and anxiety about these issues. So a couple of things to say about the work of the Hearing Voices Network. It's been established for about 25 years now, and I think it's a really fantastic example of people doing it for themselves. The work is led by people like me who have lived experience of hearing voices. Many of us have had horrible things happen to us that kind of drove us mad in the first place, and we've been on our own journeys of healing and recovery, and found a way to really live with our experiences and feel, I guess, that we want to try and shape services so that they become more helpful to people. I think one of the brilliant things about the Hearing Voices Network that's made it so successful is that we work a lot with professionals who are like-minded. So I certainly am happy to critique biomedical psychiatry, but I have worked with many fantastic professionals, including some great psychiatrists. So I don't have problems with all psychiatrists, just this biomedical psychiatry, which views people as people with symptoms rather than people with problems that really make sense to me. So the movement was, in fact, founded by a psychiatrist, Professor Marius Rom, and his partner, Dr. Sandra Escher. And Marius Rom unusually listened to one of his patients who was really demanding that her experiences were real and meaningful and not just a sort of an aberrant symptom that needed to be medicated away. Because, of course, biological psychiatry very much sees voices as a product of brain and cognitive faults. But one of the things that Rom and Escher have done is advocate a radical shift. And really, you know, Rom and Escher have been around for more than 30 years now in doing this work. But what their work is saying in a nutshell is that, one, that voices make sense, that they always make sense when you know the context in which those voices initially emerged, and that the other is this very powerful link between people's voice hearing experiences and the traumatic things that may have happened in their life. And I'm going to come back to this idea of trauma, or maybe adversity might be a better way of framing it. But yeah, there seems to be this overwhelming link with the bad things that have happened in people's lives and the fact that they began hearing voices. So in fact, Romanesh's research shows that about 77% of people who hear voices have had some traumatic experience. So when you interview voice hearers and ask them what was going on in your life before the voices began, time and time again, people would talk about these very frightening, very overwhelming, very stressful things that were going on for them. It's important to remember that Roman Escher weren't looking for traumatic experiences. They were just looking to understand more about what caused people to hear voices. And in fact, other researchers have since gone out and asked in more detail about what was going on. And that figure is even higher now. So for me, there seems, I've always known this. Those of us with lived experience have always known this, that it's the bad things that happen to you that drive you crazy. But finally, the researchers are catching up with us that really know. And the evidence really is mounting. And I'm going to come back to the evidence. So just to give you a sense of, well, what are voices then? Why do people hear voices? Well, they're a survival strategy in the way that I described, really. They often point at real-life problems in the past and the present. They use metaphorical language that can be translated into real-life challenges. So sometimes people talk about psychosis as being like awake, when, like in the same way that when you dream, you have these really weird experiences, that psychosis is like being awake in a kind of dreamlike state, where things have a metaphorical and a kind of symbolic meaning, but nevertheless it is meaningful. And I think part of what is required is the willingness to enter into another way of seeing things with that person and understand, well, what do these things mean for you? Voices can be split off feelings that are unbearable, awful messages about terrifying past experiences. As Maris Rom says, voices are both an attack on people's identity, but it can also be a way to protect or preserve their identity, which makes sense when you think that often voices come out of extreme experiences. So they're both protecting the person and are connected to this sense of being attacked and overwhelmed. So people feel very ambivalent, understandably, about their voices. And I guess one of the questions for me, traditionally there's this real split between voices that are deemed to be sort of psychotic and voices that are deemed to be dissociative. And what I'd say is that, like all human experience, they're on a continuum, and that voices are actually just gradations of the same kind of thing. So the Hearing Voices Network runs a range of services. In England alone now, there are more than 180 Hearing Voices self-help groups. Groups running in the community, groups running in secure settings, groups running in prisons. In London, we've been funded to set up Hearing Voices groups in every London prison. We've also been funded to set up a number of self-help groups for children, because as you know, as I've said, many children hear voices. We're doing lots of work with mums and dads, because one of the things that we've found is that if parents are better supported, they're often in a better place to support their children who are really, really struggling. And the amazing thing about the Hearing Voices Network is we do all of this on very little money. And one of the things that I've learned as a resourceful person is a lot can be achieved with very little resource, actually, with enough sort of guts and determination and good people involved. We're also a part of Intervoice, so I'm the chair of the National Hearing Voices Network in England, but this is an approach that is spreading like wildfire across the world. So there are Hearing Voices networks now, and bear in mind, in England was the first network to develop, and it's now spreading across the world. So there are networks in Australia, Austria, Belgium, Canada, Denmark, England, Finland, France, Germany, Greece, Holland, Ireland, Italy, Japan, Kenya, Malaysia, New Zealand, Norway, Palestine, Scotland, South Africa, Spain, Sweden, Switzerland, Uganda, USA, and there you go, there's Wales. And I've been very fortunate in my work with the Hearing Voices Network that I've travelled to a lot of those countries to do work. So there have been some benefits to going mad, I've discovered. So yeah, this is an approach that is spreading like wildfire. And one of the important questions that I think it raises, because one of the criticisms of the Hearing Voices approach is, well, where's your evidence? You know, Rom and Escher did their initial research in terms of understanding what causes voices, but where's your evidence that groups work, for example? Where's your randomized control trial to prove that this works? And despite the fact that there's no evidence, these groups are popping up all over the world, which for me asks a really important question about, well, who cares about research? Because what about the evidence before my very eyes? What about the fact that having a stigmatizing and isolating and frightening experience and getting together with other people to talk about that helps? Do I need evidence to prove that to me? So I think this is important, really, just in terms of the theme of today, really, in terms of sort of demedicalising these kinds of experiences. Actually, you know, despite the fact there's no evidence, these groups are just spreading and spreading and spreading because they change people's lives. So I talked a little bit about recovery, and I just wanted to talk about, and I think it's a term that has become quite problematic. I think within the user movement now, some people just find the term too problematic because it's become really co-opted by services to mean something quite different. Within the Hearing Voices approach, what we mean by recovery is this, really, that when people are in crisis, we believe that that's happening for a good reason. We don't think it's about a problem in somebody's brain, although there may be things happening in people's brains. It kind of goes back to this, rather than asking what's wrong with you, we need to start asking people what's happened to you. In my work with voice hearers, and I've worked with hundreds of voice hearers over the years, what I found is however crazy someone appears, however disturbed they appear, when you spend time with that person and you get to know them and you listen to them and you hear their story and the context in which they kind of went mad, it always makes sense. People make sense. So when people come to us, even if we don't really know what's going on, we work on the basis that something meaningful is happening here, and we're just going to hang out with you and spend time together and help you feel safe and help you feel a part of this group, and we'll just acknowledge that you make sense. And what happens is people begin to develop insight into their own experiences. They begin to see that actually when I'm feeling really frightened and anxious, for example, my voices are very frightened and anxious. There's a connection there. And that reminds me of something that happened previously, before I went into hospital, and people start piecing together the bits of their experience, and they begin to develop self-knowledge and self-awareness, which is crucial, really, in your own healing and recovery. So they begin feeling as if they're embarking on this journey of recovery. And people start growing, their sense of themselves start expanding. And they might have another crisis. I've had thousands. But it's an evolving process. It's not something that is fixed. I talk about healing and recovery as being a lifelong journey, as like a spiritual practice for me. That's how I like to think about it. But what happens is that each time people move around this process, go through this cycle, their sense of themselves is enhanced. They make more sense to themselves. They feel more connected to themselves and other people. And this very much fits with the evidence that's emerging, finally, which shows that actually there are a broad range of things that drive people mad. As I've spoken about, it's very clear what drove me mad, these awful experiences of abuse. And I sometimes talk to people and they say, well, I nothing like that ever happened to me. But actually what the research is saying is that there are a wide range of adversities that can be predictors of many forms of serious mental health issues, including psychosis. So this is from a recent paper in the British Journal of Psychiatry. So these adversities have been found to include mother's ill health, poor nutrition, high stress during pregnancy, being the product of an unwanted pregnancy, early loss of parents via death or abandonment, attachment difficulties, witnessing interparental violence, intergenerational trauma. This idea that, the impact of trauma, for example, in Northern Ireland, a lot of work's been doing post the Troubles, looking at the impact on children where families have had devastating experiences in the Troubles, and that children are impacted, which may be another explanation about how these things are passed on in families, for example. What's called dysfunctional parenting, this sort of affectionless over-control where some parents are very, very critical, hypercritical, as they feel that's the best way to kind of parent, but don't give their children lots of affection. There seems to be very strong connection there with serious mental health issues. Parents that use substances have mental health issues and criminal behaviour. Of course, childhood sexual, physical and emotional abuse, emotional or physical neglect, bullying, lots of research now coming out about the devastating impact of bullying, childhood medical illness, war trauma, poverty, racism, and other forms of social inequality. And just to sort of highlight this is from the spirit level, again, just to sort of underline this idea about the sort of social impact on people's mental health. There's a lot of studies coming out now showing that there's a much greater prevalence of mental ill health in countries where there's a greater disparity between the rich and the poor. So, of course, as you would expect, the USA leads because there's a much greater gap between the rich and the poor in the USA, closely followed by the UK. And in fact, there was a study that came out yesterday that is showing that if you live in the poorest borough in London, your good health years are decreased by 20 years. So there's lots of studies now coming out talking about the impact of sort of things like poverty and social inequality. And again, I thought this was important, thinking about the theme for today. How do we, with this kind of knowledge, use it to shape services? If we need to move away from this very medicalised way of thinking about things, and not locating problems in people's brains, but seeing that actually people's distress is very much a consequence of their environments, then I think we need to start thinking about things like social deprivation and how do we support each other during these hard times. And thank you. And just to make the point again about childhood adversity and psychosis, that this evidence is accumulating really at a rapid rate now. If people want references, come and see me. I can give you lots and lots of references. So, for example, this is Janssen et al. 2004. For example, research indicates that those abused as children are 9.3 times more likely to develop psychosis. For those suffering the severest kinds of abuse, the risk rises to 48 times. People who've endured 3 kinds of bullying, so for example, sexual abuse, physical abuse, and bullying, are 18-fold higher risk of psychosis. And for those with 5 types of abuse or trauma, 193 times more likely to become psychotic. And, many people would argue that there isn't the same kind of evidence for a biomedical model. This kind of evidence doesn't exist in the same way. So furthermore, individuals with psychosis are 3 times more likely to have experienced childhood sexual abuse than those with other diagnoses, and 15 times more likely to have been abused than non-patients. So this link does appear to be a causal one, because of course one of the sort of techniques being used by biological psychiatry now is to suggest that this thing that people are told in services, we know you're abused, but that's separate to your mental illness. And actually, what the research is saying is that this is causal, that these experiences cause these very extreme reactions. I mean, I've got 3 O levels, and I'm not very educated, but, kind of makes sense really, doesn't it? with a dose-dependent relationship. So again, the more forms of trauma and adversity you have, the higher your risk of going on and develop more extreme reactions. So despite all this, unfortunately, we still have this biomedical model that persists. It is changing, thankfully. There have been a number of editorials in the British Journal of Psychiatry in the past couple of years talking about this crisis within psychiatry. But what I see a lot of is this, that people go into services, that the things that may have driven them there in the first place are not really explored. So there's a kind of denial about the reality, I think, of people's experiences. So I know people who've said, well, I had this really horrible abuse, or I was bullied, and yeah, we know all that, but you need to take on board that you've got a serious mental illness. So it's seen as a kind of separate thing. George Orwell talked about this concept of doublethink, where we hold these sort of contradictory ideas at the same time, and I think doublethink exists in a lot of our services, actually. And people are encouraged to take on board that they have a serious mental illness. And for people with the most extreme distress, people who end up being diagnosed with things like schizophrenia, schizoaffective disorder, increasingly bipolar, of course, that's the new kid on the block. Once people accept that they are mentally ill, then they're deemed to have insight. So I think insight in traditional services has quite a different meaning to the way that I understand insight to mean. And once people accept that they're ill, accept that they need to take their medication, then they're deemed to have recovered. And then people are sent home. If there's fears that people are not going to comply with their medication, certainly in England, I don't know what the score is in Wales, but people are put on CTOs, community treatment orders, so that people are really being forced to continue taking medication that they may not want to take, despite the fact that Robert Whittaker's work really is saying that for some people, that medication will decrease your life expectancy by up to 20 years. And people go home with their new medication, often having put on large amounts of weight, shuffling, obviously experiencing medication side effects, and the original and underlying issues that sent them into services in the first place often have not been explored. So guess what happens? People relapse. People fall apart, people feel very hopeless, and they end up back in hospital again. And this, I think, is what we have, this sort of classic revolving door patient. And actually, it isn't because people are very, very ill. I think it's because services are not making this a meaningful opportunity for people to really explore what's going on for them. So I guess the challenge for us is to think about how do we try and encourage services to start making this a meaningful opportunity for people to really explore what's going on for them, and how do we as individuals and as communities start supporting each other to try and explore these experiences. So I talked about the personal is the political, and in terms of my own healing and recovery, I feel like I've come a tremendously long way. I still have difficult times, don't we all? Life isn't easy, but I actually feel very blessed. I've got work that I'm very passionate about, work that I really enjoy, that I feel makes a difference, and that's enormously satisfying. I have some fantastic colleagues. I have a lot of love in my life. I have a good laugh. So I do feel like, actually, despite the terrible things that happened to me as a child, that I am one of the lucky ones. But until we start acknowledging what really drives people crazy and what really is at the root of a lot of people's distress, and create services and a society that really supports those that are most vulnerable, then for me, the personal remains political. Thank you for listening, everyone.
Very much, Jacqui. That was really interesting, and I just say to Jacqui, she's finished spot on time as well, which is a real achievement with so much to say. One of the phrases that was coming into my mind as you were speaking, Jacqui, I've come across in mindfulness-based work, is shattered but still whole, and that came to mind. That sense of being shattered but still having a sense of wholeness, and that was really inspiring. Thank you. Well, we do now have time for questions. So if anybody has got a question, we have got a mic at the front, and if anybody would like to indicate any questions, any comments that have come from today. Yes, at the back and the left there.
The one question that really went round and round in my mind was, through the tragedy of this abuse you had, you felt you had a motherly figure that could talk to you. And then gradually you went on, and then you found other figures that told you to hurt yourself. How were you able to differentiate the good figure, or do you feel all of them were good to you? All these voices coming into your head.
Yeah, it's a good question. I guess even the ones that were telling me to hurt myself, they were attempting to deal with this sort of chronic pain I was in, really, and trying to cope with this distress in the best way that they could. And I guess years later when I went into therapy, and one of the techniques we use a lot in the Hearing Voices movement is voice dialogue work, which is kind of contrary to the traditional approach, which is very much about not listening to voices, not engaging with voices, but the voice dialoguing work is very much about talking to the voices. So I began asking the voices that were telling me to hurt myself what was driving them to say that. And what I understood is that they felt ashamed, they felt responsible, they felt guilty for what had happened. So it was about really healing a lot of that and being more compassionate, developing more compassion for those voices. And when I began understanding what drove them and treating them with more kindness and compassion, they felt less like they needed to compel me to do those things. Does that make sense?
Yes. The only one thing I want to add, which is absolutely nothing really to do with, but you brought me back many years when you said about yourself being admitted to the ward. Now, as I say, I was a general nurse, but I did spend, as part of our training, 6 weeks on a psychiatric ward, and I actually saw patients come on and they were just left. Yeah. There was no intervention with nurses. I'm just hoping that doesn't happen today, because I'm sorry for what happened to you then, because
Thank you.
You were at a crucial moment and yet no one came to you. Sorry about that.
Thank you. Well, I don't use services. I haven't for years, and but I hear different things. I hear some services that are fantastic. Some wards where there's a lot of care. There's things like mindfulness, and then I hear a really broad range of things. I hear of people going into hospital and not being spoken to still. So I think both exist, and I don't know what happens locally. In my experience, it varies tremendously, even in local areas, I think.
Thank you. Any other questions? Yes, there's a hand up at the back. Sorry, Laura, it's right across there.
Hiya. You say that your voices told you to hurt, to self-harm. It isn't just about people who hear voices who self-harm.
No.
And even nowadays, there's an awful lot of ignorance within the medical profession about why people self-harm. And also, I give an example of somebody, a young boy, who goes into the doctor's surgery. He's needle phobic and he needs an injection. And because he kicks off because he's anxious, the GP then turns to him and says, well, why have you got a problem with having a needle when you've got all these cuts on your arm? And this happened a few months ago.
Yeah.
Yeah. When you look at the NICE report on what to do with children who self-harm, it is not the same as with adults who self-harm. Yeah. And there needs to be more research and more understanding on the causes of people to self-harm and what you do if you stop somebody from self-harming.
There's lots of good stuff out there about self-injury. I mean, I agree. I speak to lots of survivors and young people who end up in A&E and having really awful experiences in A&E. And, you know, as you say, these very insensitive comments. I know people who've been sutured without anaesthetic because they've been told, well, you've cut yourself. It's like punishing. And again, there are some really innovative things happening. You know, A&E now having specialist nurses to meet and greet people who have self-injured, but these are quite rare. And in terms of research, I think we just need to ask people who self-injure because they know why they do it.
Can I actually say what the local children's mental health team has told me to do? And this is contrary to what I believe and what I know. They told me to remove the cut and implement, yes, because I was the carer for that person. I had to do, even though I disagreed with it, because this person was known to social services, I had to remove what they used. And this person then escalated into using something sharp and things, and the self-harm became more deeply entrenched because the local children's mental health team did not understand enough about self-harm to say the right way. And it's all led from NICE down.
Well, and actually, I think that advice was kind of contrary to advice to what I would give, which is, you know, if we think about self-injury and a lot of these coping mechanisms as well, in part about people trying to get back some control, then to take that away is actually the worst thing to do. And what, you know, if there's some really good work that's come from survivors, and a lot of good practice now is about harm minimization. So not taking self-injury away as a coping mechanism, but actually making it less harmful, which is a slightly different issue, I think. And actually, sometimes this is what we have to do. We have to go against conventional wisdom. And I think I'm just pulling that out really as a theme for today. That, you know, the conventional wisdom that you were given was that this was the way, but actually your gut instinct told you something different. And sometimes we do have to listen to our own gut instinct, I think, to find the right thing. I'm aware there's lots of other people who want to make comments, so thank you for that.
I think we have two questions at the front, then I think there was a question from the gentleman at the back as well, and one other. That might be all we have time for.
Actual complex questions, so I'm trying to simplify it. People who work in mental health services, a lot of them want to go from a biomedical model and actually try and empower people and recover people and follow their journeys and stories. However, we are constrained sometimes by national and local and sociological issues, like when things, I'll use the word, go wrong, when there are suicides, it's medical professionals and nurses that are then into coroner's court, and parents are saying, you should have done more, you should have prevented that. So there's sociological issues, and I just wondered how your network, how you were trying to work with governments and that put these constraints on services about, you know, risk and being risk averse and positive risk taking, because that sometimes confines services to what they want to actually deliver.
I think it's a massive issue. I have lots of conversation about risk. Because, you know, as soon as we start talking about doing something different, risk rears its head. And I was doing some work in the northeast of England recently with a trust, and to run Hearing Voices groups, suddenly we're going to have to risk assess the person each time they come to the group, and which I just thought was completely absurd and kind of counterproductive, really, when people are assessed when they come into the service, and then they're apparently meant to. But with talking it through with senior managers and thinking about, well, what are those fears and how that would be counterproductive, people were willing to try and do something a little bit differently. So I guess it does mean things like positive risk, taking positive risks, because I think you have to sort of, well, what will be the risk if we don't do this? That's one way that I framed it to this trust. If we don't do this, then people are going to be left at home to be very distressed on their own, and that may increase risks in other ways. I guess there's a wider issue as well. I'm very critical of a sort of biomedical model, but I think one of the challenges then is, well, how do we contain people that we're worried about? And I think what that means is that we, as a society, cannot just leave that to psychiatrists. We as a society are going to have to come up with some alternative solutions, because I actually know lots of psychiatrists. I work with them, and I have many friends who work in statutory services, and I understand how nerve-wracking it is when somebody is a worry, both on a human level and on a professional level. And I think what we as a society need to do is start sharing that a bit more, and not absolving all our responsibility and giving it to these sort of professionals, because I guess the flip side of all that responsibility is then they have a lot of power. So
hello, Jacqui.
Hello.
Thank you very much. And I think perhaps there's also scope for you to be more grandiose, and perhaps you paved the way for some of us who would be more grandiose.
More what, sorry?
Grandiose, your phrase. I think that the term "the personal's politico" is amazing. Political. I think also the individual is historical might be one.
Yeah.
I have two very brief questions in that. Would you be able to weigh off the neglect and threats without going too much into your personal history, vis-a-vis or against the thing that we have to discuss, because this is the second part of the question. How common would you suggest from your research that abuse that you suffered and many other people suffered is, without using too many quantitative terms? Is it possible to briefly comment on or answer those? Thank you.
Well, according to the NSPCC, 1 in 4 girls and 1 in 5 boys will have an unwanted sexual experience in their lifetime. So it's very common. It's very, very common. And there's quite a lot of research out there. The work of John Reed, who's really pioneered this important link between trauma and what we call psychosis, or sexual abuse and serious mental health issues. And what he found is that people on average spend something like 16.8 years in psychiatric services before anyone ever asks them about sexual abuse. So there actually is a government initiative now that people should be asked when they're admitted to services about sexual abuse and violence, sexual violence. But it still doesn't happen, I think. And then the problem is, of course, we ask people, and then what do we do about that? We ask them and we just tick another box. So I think there is endemic trauma and abuse in our society, and I think it's something that is happening on a kind of catastrophic scale and really needs addressing. I mean, clearly not everyone who experiences abuse ends up in services, but what the research is telling us is that those of us who've had the most extreme abuse do end up in services, and often it's not addressed, and I think it's a travesty. For me, it felt like insult really to injury. Am I answering? I'm happy to give more references and stuff afterwards if that would be helpful. Thank you.
Thanks, Jacqui. There's one question on the back table, and then one I'm afraid we're going to have to stop after the last question.
Hello.
Hello.
One of the things you didn't mention, but I'd like your thoughts about, is lack of sleep.
Yes.
Basically, from my side, I'd be churning things around in my mind, having like a washing machine. And I did something unusual. I took notes, and I found that would bring me down from my mania. I did take them about 1.5 to 2 hours before I went to bed, and this means, having taken the notes, I wasn't worrying about my thoughts. It helped me have more of a nice night's sleep. If I didn't sleep, I'd see how I woke up in the morning. If I was drowsy, then it's just one of those things that had happened.
Yeah.
If I still feel I got these racing thoughts, I know there's a problem and I should look for help. I just thought I'd make those comments and see what you thought.
If we'd had more time together, I would certainly have spoken about sleep, because I think it's really, really crucial. When I do training, I train a lot of professionals. I often talk about the importance of trying to help people sort out their sleep. There's actually a lot of research out there that lack of sleep can drive you mad. I mean, of course, it's one of the techniques that's used by torturers. If you go to Guantanamo Bay, that's one of the techniques that that they will use to break down prisoners, is to deprive them of sleep. So it's a sure way to send you mad, isn't it, lack of sleep? And I know for myself that if I don't have enough sleep, my voices can become noisier, and then that can make it harder to sleep, and then there can be a vicious circle. So again, when I'm working with people, attending to sleep, I think is really, really important. And I think most people would agree that if you don't get enough sleep, you feel a bit rubbish, really, and everything feels a bit more gritty, and you feel a little bit more sensitive. So I think attending to sleep, for me, I'm a bit fanatical about my sleep. I'm quite fortunate because I work for myself. And I have this experience in the afternoon sometimes when one of my voices will say, I think you need an afternoon nap, young lady. And I go off and have an afternoon nap. So I think, being really flexible, I guess, like recovery, finding your own way and doing what works for you. And so for me, having naps can be quite helpful. But really, it's important.
Thanks, Jacqui. And our last question, gentleman on that table there. Thank you.
Hi, is it on? It is on. Fascinating to listen to you. I just wondered, as you were talking, you talked about your sense of outrage and your sense of justice. Was there an opportunity for you to actually meet or confront your parents as part of that recovery process for you? Or was that something that you just put to one side?
No, it's something I attempted, and I've attempted to get justice in a number of different ways. But I have confronted my parents, and they're not really willing to sort of acknowledge what happened. And I've also been to the police to try and pursue a prosecution against the main paedophile in this group, and that isn't possible either, for reasons that are kind of a bit too complicated. I mean, as we've seen with a lot of these recent cases, it's actually very difficult to get a prosecution. And the police officer that I spoke to, the main person who abused me, is known to the police. He was investigated by the police. He's a prolific abuser. And they actually had a big fat file about him, and they weren't able to bring a prosecution. They spoke to me about whether I wanted to investigate doing that, but I was really asked to think about the impact that would have on me and my life and my family's life. And to be honest, I don't have a lot of faith in traditional systems. Do you know what I mean? So this for me is a form of social justice, and I speak out. I mean, for me to be able to speak out about what happened to me is really, really important. And what I found, I know that there are other people in this room that will have had similar experiences to me. There always is. And I know that it's really meaningful to other people that I speak out about these things, and that it enables other people to start speaking out too. And so I guess I'm pursuing justice in a more creative way, really. But yeah, it would still not be nice. I do have that image of seeing them, behind bars, still.
Thank you, Jacqui.
Thank you.